make some request from my students. I will come there. Good evening, ma'am. Good evening to all. The viewers are set to begin the session. Ma'am, welcome to our webinar series. A very good evening, one and all. I'm happy to invite all the participants over here for today's webinar session. And Dr. Sangeeta Magesh, ma'am, I can say for relationship, she is one of the pioneer, I can say, one of the sound knowledge person in the field. And when you get a feedback from the participants who were attending program or training program conducted by Dr. Sangeeta Magesh, I think they will say a lot about the innovative way to making better relationship. It may be not only that family, we can have it in an industry or education setting. Wherever you go, we can maintain that tips given by Sangeeta Magesh. Thank you, ma'am, for accepting our invitation. On behalf of the Department of Psychology, American College, our co-associating institutions like Mega School Associate of Chennai, M.I. Chellamuthi Institute, Madurai, Department of Psychology, Madurai, Kamaraj University, the International Center for Clinical Psychology and Psychotherapy, Germany, International Association for Psychoangiology, Turkey, and our co-associating institutions and core team members. On behalf of core team members and participants over here, I welcome today's speaker, Dr. Sangeeta Magesh. She is a counseling psychologist and founder of Psych Cafe. You can go to the website and you can get a lot of information. And in the Google map, a lot of positive feedback. So this is about Dr. Sangeeta, brief introduction, and I invite my core team member to introduce the speaker to all. Once again, I welcome you, ma'am, for this webinar session. Yes. So over to you, sir. Veera, sir.
Yes, I requested Dr. Sir to do the introduction part of. Salim sir, are you there, sir?
Yes, sir. Good evening, one and all. It's my pleasure to introduce the today's speaker, Dr. Sangeeta ma'am. Today's session is 252nd session, and the topic of the session is importance of relationship enhancement counseling by the resource person Dr. Sangeeta Magesh, counseling psychologist and founder of Psych Cafe.
Sir,
Pardon, sir.
The details are in the website, sir.
Yes, sir. Yeah, I found it. She has pursued her dreams with stellar results. the Madras Psychology Society Gold Medal in MA Applied Psychology, and the Durganand Singh Best Dissertation awarded by the National Academy of Psychology at Christ University, Bangalore. And her PhD thesis are but two of the many rewards and recognitions she has received. She started her counseling practice over a decade ago and has successfully helped couples, young adults, and people across the entire age spectrum address their relationship problems. Her flourishing clinical practice notwithstanding, she is also an affiliate EAP counseling psychologist for various corporate and industries in around Chennai. Having played the role of in academic, having played the role of academician holds her in good stead when she is invited frequently to deliver talks and conduct workshops in her area of expertise, like relationship management at various colleges in and around of Chennai. In addition to and as a logical progression of her academic work, she has also attended many conferences and presented scientific research papers. She is glad to discuss with the help anyone interested in knowing more about this aspect of this work in detail. And his organization is PsyCafe. PsyCafe is the culmination of all the expertise Dr. Sangeeta Mahesh has gained from the synergy of her counseling, workshop, and research activity that she wants to employ in reaching out to people with relationship issues and solving them. Welcome, ma'am. So it's our pleasure to welcome to you. Over to you, ma'am.
Thank you so much, Dr. Salim sir. And also request all the participants to please mute your video as well audio. In case of switch on video, make sure to wear a decent outfit, and all your queries can be clarified end of the. We have a question answer session, and also maybe few PPTs available today, and one and there it will be today's speaker, Dr. Sangeeta ma'am. Ma'am, we have taken much time. Sorry for that, and I request you to present all the sincere participants.
Thank you. A very good evening to all the participants out here. So at the outset, I would like to extend my hearty congratulations to the team, to the organizing team, who have touched the 200 odd webinar today. It's tremendous work, highly commendable. Congratulations, the coordinating team. And I'm very glad to be on the platform today to address a group of people on the topic of relationships, something that's very close to my heart. That's exactly what I do every day. It's finishing for another reason because I just finished 2 webinars now. This is my 3rd webinar for the day. But somewhere the topic was connected to the pandemic of COVID-19. So this is a very refreshing topic. We are not going to talk anything about COVID-19, nor are we going to make any reference to the same. We will completely stick to the most beautiful aspect of human existence called relationships today. So I don't have a full PowerPoint presentations because I don't really trust technology much to the extent I trust myself. So I won't have a full-fledged PPT for today. I would like to make the session very, very relatable because relationships is not something that's a very exclusive topic that most of us cannot relate to, highly relatable because whenever there is presence of one other person than us, then there is a relationship there. So I'll try to make it as relatable as possible, and I will not speak for more than 30-40 minutes, I promise. Okay, because I would be more glad to take questions from you because I understand it's a very mixed group because it's an open to all webinar. So I don't really know what is it that you're looking for from this webinar. So I will share with you my inputs that I have planned for today in the minimal time that I will take. And the rest of the time, I would like to denote for a question answer session because I think that's more fruitful at the end of the day. Is that okay with all the participants? Can someone unmute and answer?
Yes, ma'am. It goes well with us. Thank you.
Thank you. Yes. So when we are talking, the topic of today is importance of relationship enhancement counseling. It's actually a very complicated topic because today, for the purpose of my session, I will be only looking at personal intimate relationship. Now, if I use this term personal intimate relationships, for a Gen X, it would mean nothing more than a marriage. But today, we are essentially living in a society where there are a lot of millennials and Gen Z, right? So the point, the understanding of the term personal intimate relationship itself needs a deeper exploration before we go on to see, how counseling for this would help. I think that's where we need to start from, because all of us have to be on the same page to understand what intimate relationships mean in today's scenario. Because it was much easier for us to understand that intimate relationships would mean marriage and nothing more. But in today's scenario, it is a complex variety of relationships that we have. Now, when we look at the concept of relationships itself, it's nothing new to humans. Right from early man, when we look at it from an evolutionary perspective, from the time early man started having a family, started having a companion, relationships were there. But obviously, the gender role description that was given to the man and woman from an evolutionary perspective is very, very clear. The man was the provider.
The colleges pertaining to the wildlife crime and the investigation of the wildlife offenses. But it can be
participants. Yeah, thank you. So for a man, it was the provider's role which was given, and for the woman, it was the domestic role that she had to take. In fact, mate selection also was based on that, because a woman will always look for a man keeping in mind her and her children's safety and protection. So she would always look for a man who was physically strong enough, who would take care of her child's and her safety. And for the woman, she will always, and for the man, he will always look for a woman who will give birth and take care of his offspring. So the expectations were very clear, demands were very clear, and the job role discrimination absolutely clear, right? Then as we evolved, as urbanization, civilization, and industrialization set foot in, slowly relationships started undergoing a slow shift. It wasn't a paradigm shift though, but a slow shift. Women started getting educated more. They started getting economically more independent, right? But more so, men remained in their provider roles. It is only up till very recently, that men also started taking on more domestic roles. Okay. But still, I wouldn't use the term inequality because it might trigger a sense of discrimination. That's not what I'm trying to say. But it is the percentage of women who take up provider roles are much more than the men who take up domestic roles. Even from a research perspective, this is what the finding is. And whatever I'm going to share here will predominantly be related to indigenous research. I will not look at research studies done abroad in the Western countries because that may not suit our population, right? So this is how evolutionary perspective, this is where we come from. And where are we today? Today, when we are looking at intimate relationships, now you have n number of contemporary relationships like open relationships, you have friends with benefits, you have live-in relationships, and so on and so forth. Now, I wouldn't say that from a moral perspective, let's not look at it because all of us are professionals and we have been trained not to look at it from a judgmentality mode, but very much from an objectivity mode. But in practice, it's my 15th year of practice this year. So in practice, what's happening is over the past 5 years, what I see is an increase in the number of these couples who come to me who are in contemporary relationships, or not the traditional being in love or the married ones, but more in terms of the contemporary relationships. Now, if you ask me, is it right? Is it wrong? Who are we to judge that? It's up to them. But all that we are concerned about is, what are the dynamics which govern these contemporary relationships? Because we are so used to legally also, we are bound only through the normal traditional relationships of marriage. But today, when the society has a lot of these contemporary new kind of relationships, what are the dynamics that govern them? And where are the legal implications to it? We do not have legal implications to it. We all know that. But the dynamics, if you look at it, are pretty much the same. I wouldn't say exactly the same, but pretty much the same. Okay. So having said that, we need to know what are the different levels where relationship counseling operates. Now, before marriage, we used to have something called as premarital counseling, right? Now, the objective of premarital counseling is to talk to the couple who are about to get married, who have already stabilized in their relationship, who are committed in taking their relationship to the next level of marriage. Okay, a lot of topics which they need to know in terms of adjustment, compromise, finance, sex, children, right, boundaries, integrity, all these things are discussed in a premarital counseling session where both the individuals who are about to be married are present. Okay. Now, we might think in India it is not caught on, but as a practicing professional, I would like to place on record that there are so many youngsters and young adults who have reached out to me for premarital counseling. Now, again, now that we come to the aspect of contemporary relationships, now, do they come for premarital counseling? Okay. They do reach out for professional help, but they do not come essentially for premarital counseling because, like I told you, premarital counseling is for individuals who have committed themselves to the relationship and who are in the step of escalating it to the next level of marriage. But people who are in these contemporary relationships, like for example, a live-in or a friends with benefits kind of a relationship, now they have not completely invested in the relationship. They are not completely committed to the relationship, and they reach out to professionals to see if they can get into the next stage of committing to each other. Marriage is not anywhere close, right? So there, it is not premarital counseling, but premarital education. There we talk about relationship dynamics. What is it that you can expect from this relationship? What is it that you think, or what is it that you are expecting to happen will unfold in this relationship, will be the topic of discussion in premarital education. So I hope you understand that there's a difference between premarital education and premarital counseling. This premarital education is fairly a new concept which has come. Initially, we were only sticking to premarital education. Now, for the couples who have already been married, now there again, you have two categories. One is a category where there is no obvious problem or issue per se. Okay. But again, that doesn't mean they are okay in the relationship, right? That is the very reason why they reach out for professional help. So what does that mean? This is like saying being without a disease doesn't mean that you're healthy, right? So you don't have a problem per se in your relationship, but there is something lacking in your relationship. Probably you feel it is very empty. Probably you feel it is a dead marriage where two people are parallelly living under the same roof, technically married, but absolutely no quality to it, right? So there is a vacuum that is felt by either or both the partners in the marriage. So these are couple who don't have a problem per se, but yet there is some kind of a dissatisfaction that they have in their relationship, right? So this is one category of people who come to you for help. The other category of people are ones who have already encountered problems and issues in their marriage. The nature of problems can vary. It can be minimal or it can be to the extent of they have already contemplated going in for a separation or a divorce. Okay, so these are the two major categories of married people who will seek your professional help, right? Now going on to the third aspect or the third group of people who will seek professional help in relationships are the ones who have already decided that they want to go in for a divorce for whatever reason. So why I'm telling you this is, as a professional, it's absolutely important that we ask them, what is the purpose of them seeking help? What is their objective? Because it is an absolute waste of time and energy, both for the professional and for the clients, right? When they are not on the same page as far as the help objective is concerned, as far as the counseling or the therapeutic goal is concerned. So if there is a couple who's seeking help, but they've already decided on calling the marriage quits, then what is it that you do with them? Now, what you essentially do with them is focus on divorce counseling, which is also an essential part of relationship counseling, right? So the basic line, the bottom line here is, as a relationship expert, you are not a matchmaker. Your job is not to bring together people, right? Your job is only to see if two people can be together on a permanent level, but again, the priority being the psychological welfare of both the parties. So it's not to tell that it's okay, you can adjust, you can make small changes here and there, and you can pull on. That's not the job of the relationship consultant. This we have to be very clear, because only if we are clear on this, we can make the clients clear. Because many clients come to you thinking that you're going to wave a magic wand in front of them and then, kind of bring them back together. That's not the purpose of relationship counseling, right? So when it comes to divorce counseling, you understand that the emotional divorce has already occurred. They have already decided that they don't want to stick together anymore. Therefore, you have to concentrate on, as a professional, you have to concentrate on the other dimensions of divorce. Like, for example, the physical separation, the physical divorce, because they won't be staying together, right? The physical divorce, the financial divorce, because those dimensions also will drastically change post-divorce. Parental divorce, because one parent becomes the visiting parent and the other parent becomes the custodial parent. There is no parenting anymore, right? There is single parenting with a custodial parent and the visiting parent. Sexual divorce, where, one person's sexual needs are more and that person will find sexual deprivation difficult post-divorce, and how is that person going to handle it, right? And what is going to be the equation between the partners post-divorce, right? Are they going to co-parent the child for the welfare of the child, or will the child be better off with one of the parents? Now, these are the things which are dealt with in divorce counseling. Okay, so now we have seen premarital education, premarital counseling, and in postmarital, two groups of people, where a group of people reach out to you because they have a problem and they want a problem to be sorted out. And the other group of people who do not have a problem per se, but they lack quality in the relationship, and that is where they want to enhance the relationship. And the third category, where we concentrate on divorce counseling. Okay, so this is in a nutshell what relationship counseling has to offer, right? And I reiterate, the job of a relationship counselor is not to patch up two individuals. Okay, you are there to look at the permanency of the relationship. You are there to concentrate on the quality of the relationship, and also to take into account the individual psychological well-being of both the partners who are involved. Okay, it is only over and beyond this that you try to bring two people together. All right, fine. So the thing is, now we were talking about importance of relationship counseling. Why is it so important today? Right? Yeah. So relationship was something that was very much a part of us from the days of early man. Why is it that we are so extensively talking about? Mr. Shiv Kumar has raised a hand. Is there anything that I need to explain, Mr. Shiv Kumar? Oh, I think it was by mistake. Okay. So this is something that's always been taught of us. Now, why is the sudden attention that is given to it? Why is it being looked upon as something that is needing attention now? Why the sudden shift now? Simply because, as I told you, relationships are not simple anymore. Now, on account of their dynamics, they have become extremely complex. I'm not saying they are complicated, I'm only saying that they have become complex. So, because they have become complex, at a given point of time, we are paying attention to multiple dimensions of a relationship, right? Now, in a nutshell, if we have to see the importance of relationship counseling, now let me ask a question. Supposing in today's scenario, there is a girl who's about 25-year old in a family, and let's say they have to start looking out for an alliance for that girl, right? What is the first question that is asked to her? Mostly. Can someone unmute and respond?
So what is your expectation?
Very good. What is your expectation? Yes, Varlikala. What is your expectation? Absolutely. Anything else? Any other responses?
Whether she is financially independent.
Okay, whether she's financially independent. Who's going to ask her that? Jayashree?
Yeah, ma'am.
Yeah. So you said whether she is financially independent, right? So
Yeah.
the parents are going to ask her about her financial independence. See, the moment they start looking out for a girl, the first question that is asked is, what is it that you want in the groom? What is it that you are expecting in the groom? Right? How many of us, leave alone parents, even friends and acquaintances, how many of us ask the girl, how prepared are you? Or what is it that you have to offer to the groom? In other words, it is not about finding the right mate. It is more about being the right mate. Right? Which means the moment we are looking at a committed relationship like a marriage, we are so tuned into looking what is it that we are getting from the other person? What is it that we need to look for in the other person? No harm. No harm. But are we introspecting ourselves to see what is it that we have in us to offer in the relationship, to invest in the relationship? How much
So,
of, yeah.
Parents, they just assume the girl is ready.
Absolutely. Because partly it is also your parenting that is involved, right? So parents believe that their parenting has been absolutely good, and therefore, let me tell you, this great parenting, good parenting itself is a myth. Can anyone claim that we are the best parents in the world, or can we think of somebody who's the best parent in the world? No. Isn't it?
Ma'am, there is one more thing I came across recently. Recently, the thing is, age is actually, for quite some time, age is becoming a major criteria for, selecting the time to get married or selecting the groom also.
Yes.
Because, for example, what they say is if the girl is crossing 24, 25, they start telling, oh my God, it's high time you get married. Before 30, you should have 2 kids.
Yes. And your choices will come down as you age, is what we get to hear.
Right, exactly. And it's actually people start saying, because one of my friend is now 30 years. She's not married yet. So now they started telling her, see, after this, in this community, you're going to get only guys who are bald, who are fat, who have tummy, and probably or sometimes it would also be like, they're already married and divorced, or maybe they might have a kid and everything.
Right. See,
So
we
it
are only
becomes
paying
like a mental
attention.
pressure on that girl actually, that
Yes.
she has to choose someone.
See, the thing is, we are paying so much of attention to the demographic factors like age, community, excuse me, right? But we've still not started paying attention to the success of the relationship. So you get your daughter married and it is your responsibility that is of you, right? Now, there are a lot of parents who approach me and they say, "Eppadiyavadu somehow convince my daughter to get married." Right? You just convince my daughter. She's chumma saying she doesn't want to get in this relationship. She doesn't have any solid reason, is what the parents tell me. But when I talk to the daughter, right? Not that she has a solid reason, but I can see that she's completely confused with what she needs to look for in a marriage. So that is point number 2, stage 2. Stage 1, if I ask her, what is it that you have to give into the relationship? She's equally confused. Right? So, in so many instances, we find that we are so other-oriented. We look for what to see in the other person, the girl or the groom. Right? I just took the example of a girl, that's all. Right? But are we looking within ourselves? Are we introspecting within ourselves to see what is it that we are made up of? What are our ideologies? What are our belief systems? What are our values? What are our aspirations? What are our dreams? See, unless we are clear on that, how do we even fix on another person as a life partner? We need to understand ourselves first, isn't it? Before we see what we need from the other person. So relationship counseling essentially focuses on that. It operates on the mantra, it is not just about finding the right mate, it is more about being the right mate. So from your perspective, what are the dynamics that you are comfortable with in terms of communication, in terms of leadership pattern, in terms of role structure, in terms of, let's say, a degree of dependence, in terms of reinforcing. In all these dynamics, what is comfortable to you? Where do you stand as an individual? You first mark yourself on that. And then let's look at the other person to see to what extent he or she can match up to where you stand. Right? So self-introspection is a very, very important aspect of relationship counseling. Point number 2, preparedness. Okay. So the most common questions that baby bloomers and Gen X will ask is, when we got married, nobody prepared us. There was nothing called as marital preparation as such. We got married, we got to know each other, we had a couple of children, we lived for 40 years till one of us was dead and gone. Right? Now, what is the big hangama today about getting prepared for marriage? Simply because, as I told you earlier, the dimensions have become very complicated today, because that is the kind of exposure today's millennials and Gen Z are facing. Now, this was not the kind of exposure the baby boomers and the Gen X faced. It was very, very easy for them. The path was very clear. It was a very linear relationship. This is the husband, this is the wife. No matter what, you go along with the flow. But today, it is not just with respect to relationships. Now, slowly, from being a collectivistic culture, we are slowly transforming into becoming an individualistic culture. Do you agree with me?
Why left at the start?
Sorry?
True, ma'am.
Yes, isn't it? So if I come and tell any of the married couple who's belonging to the millennial generation, it's okay now, you anyway got married. you might as well, or they will give you a dirty look and say, what's wrong with you? I find no quality in this relationship. I don't find a purpose as to why you have to be in this relationship. I don't have a meaning in this relationship. Then why is it that I have to live with this relationship? A very, very radically rational question. Yes, because today we talk about individual well-being more than relationship success. True, you have to work for a relationship to work. It doesn't operate on an autopilot mode. True. But you first need to assess yourself. Even if it works, are you going to be happy in that relationship? If not, is it really worth investing your energy in making it work? Now, these are questions which we need to ask. But again, you cannot look at it from a point blank perspective that anybody can give any reasons to say why it will not work. We have a framework. And that is what is discussed in relationship counseling. That's what is talked about. That's what is discussed. Okay. So the second question for yes,
I have a small doubt, ma'am.
Yes.
They say that with marriage doesn't, if it's two people compatible, and there is an advice given that now that you have a baby, for the sake of baby, you should start adjusting and living.
Yes.
But when it is so difficult for them to live their life together or under one roof, still trying to be together, is it not going to disturb the child's life also along with their own life?
Yes.
Or is it good to do this, ma'am? Because there are quite a lot of people I'm seeing now.
Correct.
Is like we are not, they quarrel, or they give that some cold war. It's very clearly seen even to the child.
Absolutely. I understand what you're asking, Varsha. See, there was a period when people were living their marriage for the sake of the children, either for the sake of the children or for the sake of their families or for the sake of their societies, or there is a younger sibling who needs to get married, and therefore if this marriage breaks, that sibling will not get married. You had n number of reasons as to why people remained in unhealthy toxic relationships, right? But the point is, if you say a couple decide to live their unhealthy, unsatisfying, unfulfilling marriage for the sake of the children, right? Children today are very, very sharp and smart. Now, if you're talking about an aloofness and coldness between the parents, now the children are very smart enough to assess this and identify that, right? And research has very clearly shown that individuals who belong to such dysfunctional families do end up having mental health issues or even mental illnesses when they grow up. They also end up with a lot of behavioral issues. Now, the point is, we think when parents are together, the child has a conducive, compact environment. Not really, right? Even when a child stays with one parent, the environment can be conducive. Okay? It is not that only when both parents are together, the environment is conducive. In fact, it's the other way around. Two parents can be together and make the environment completely non-conducive. On the other hand, there can be one parent, either the father or the mother, who gets the custodial right of the child after divorce, who can offer an excellent conducive environment for the child. So it is not a question of, I live this marriage, it's a sacrifice for the sake of my children. You are actually playing havoc with the psyche of the child. Because a marriage or any relationship for that matter can work only when there is a personal conviction to make it work. No external factor can compensate for that personal conviction. Have I answered your question, Varsha?
Yes, ma'am. Thank you so much.
Yeah. Okay. So there are some questions on the chat box. I think we'll go for it once I'm done with what I have to say. Okay. I'm not looking into it now. So the third important thing that relationship counseling focuses on is identification of any psychiatric disorders. This is something that is very, very common to the extent that we don't think is existing. But in reality, I mean, you don't find probably major mental disorders like schizophrenia or depression or bipolar, because those things are very evident. I mean, you cannot miss it, right? So when an alliance comes, when these kind of things, it cannot be hidden. But what is very subtle but very, very powerful in breaking relationships is personality disorders, especially the cluster B personality disorders of antisocial personality, borderline personality, narcissistic personality, histrionic personality. Now, these personality types have very, very stormy interpersonal relationships, not only in intimate relationships, in any relationship whatsoever, and it's felt to the highest degree in interpersonal relationships. Cluster A individuals, again, like schizoid or schizotypal, they are again, I mean, you won't miss it. And they are people who will not seek relationships. So they probably don't get into relationships, but in case if they get into, again, that's a disaster. But it's the cluster B relationships which we normally see in practice to a very, very high frequency these days. And it is absolutely difficult to live with a person who has a cluster B personality. And it is also extremely difficult to part ways from a person who has a cluster B. So it's not that I get married to this person, let me try. If it doesn't work, it's not that easy, right? Because cluster B individuals are highly manipulative, and legality only looks for evidence, right? So if you're not able to make that evidence, then you will never be probably granted the divorce, and you continue to live with this person for life. Okay, so they are highly manipulative, they are highly self-centered, they have absolutely no guilt or remorse for whatever they do. They cannot apologize because they don't even think that they have made a mistake. They're very cold, very aloof, a personality which is very difficult to live with in an intimate relationship. But when they come for relationship counseling, these personalities can be identified, right? So if that person is planning to enter a marital relationship, then that can be prevented, right? But in other kind of contemporary relationships, they don't really need to come because they would have felt it when they were together. So they will not probably escalate into the next level of marriage. But again, what happens is a lot of abusers, that is also something that is very prevalent among youngsters today. They undergo a lot of abuse without knowing that they are being abused. Because we only think about physical abuse, sexual abuse, or verbal abuse. But more than all this, something that is extremely powerful today is emotional, financial, and technological abuse. Extremely prevalent. And many times we think that's the way people are living today. No, I'm sorry, it's not. It is abuse, right? There is something called as micro cheating in technological abuse. Even when a partner saves the name of another person of the opposite gender under a fake name, it is technological abuse. And you can't lie about your relationship status in social media. That's technological abuse, right? And you can't make a call to somebody probably whom your spouse does not approve of and delete that call. That is technological abuse. That's micro cheating, right? And these are some of the instances I'm quoting. I mean, it's n number of things that come under technological abuse, but these are the common things that we see, right? And financial abuse. Sometimes even when two people are in love, you will see it's only one person. I'm not specifying the gender. Sometimes it's the boy, sometimes it's the girl. So it is just that one person who keeps on spending for the other person, and there is no reciprocity there, right? All these amounts to abuse. Now, all these things can be identified in relationship counseling. So relationship counseling essentially follows a preventive modality more than a corrective modality. Not that it doesn't, but any day a preventive modality is far better in relationships than getting into corrective mode, which is precisely what the next point is about. Because one of the most important reasons as to why people need to seek professional help before they get into a committed relationship is to prevent toxic resentment. Because when a couple walks into your clinic after being in a marriage for 5 years, let's say, right? That 5 years, there is a lot of bitterness that has built in both of them. And we know as professionals all that accumulates into traumatic memories in the hippocampus, which is essentially a part of our biological system, right? It's easy for us to say, let go and move on. Even this concept or the phrase of let go and move on wasn't there a few years back, if you realize, right? It's a very, very millennial term, right? Let go and move on. It's easier said than done because there is a lot of biological support to not let go and move on. A lot of brain parts are involved when you are committed to a person. You know, when you experience pleasure with the person, dopamine secretes in the brain, and dopamine is the very chemical which gives us pleasurable feelings. Now, that is the chemical which is involved in all the addictions because it's again related to pleasure. So it is very difficult for us to let go a person when we have experienced pleasure with that person at some point in time. So because of that, we try to translate all the negative things concerning to that person in terms of generous interpretation. He's actually not like that. Most of the times he's not like that, but sometimes he's like that. How frequent is the sometimes? 5 days in a week, right? So, in order to get an objective view of whether you are being abused in a relationship, now I have had clients who have reached out to me to find out whether they are being abusive to their partners. You know, because it's a very thin line, right? Because today, when we were talking about contemporary relationships, I said the dynamics pretty much remain the same, but there are minor differences in the dynamics. For example, when you take the concept of controlling, right? Now, for a person who's been married for like 15 years, when you ask, is your husband very controlling of you? She would probably say, not really, because he only expects me to tell him where I go, but you know, he doesn't expect me to get his permission. So for her, controlling is only if he expects her to get his permission. But if you go to a Gen Z and you ask whether the husband is controlling, she say, yeah, extremely. So can you give me instances why he's controlling? Every time when I step out of the house, I'm expected to tell him where I go. So that is controlling for her. So the dynamics are very different, right? So that is where relationship counseling really plays a role because it kind of grounds the individual to the dynamics of relationships. They will have a better clarity on what to expect and what not to expect, right? And the other important thing is the cultural background from where we come from, right? Like I said, we all essentially belong to a collectivistic culture, which is slowly transforming into individualistic culture, but it's not gone for a complete transition. So we are kind of in the transitional phase, and you know how stressful the transitional phase is. So supposing you, even if you are not living in a joint family per se, even if you're living in a nuclear family, still individuals in nuclear family are impacted by their in-laws or extended family who are not essentially staying with them, you know, because we come across couples who are there in the US, but what chutney they have to, the daughter-in-law has to make is decided by the mother-in-law in Karikudi, right? So where are the dynamics there? Where are the boundaries there? So it's not about physically being together, right? You might be away physically, but psychologically you are still enmeshed. Being connected is healthy, but being enmeshed is definitely unhealthy because when you are enmeshed, there are no boundaries whatsoever, right? So, so these are the essential things which are taken care of in relationship counseling, which helps predominantly to identify the potential in each one of the individual, the potential that is helpful in making the relationship work, right? And especially in today's days of contemporary relationships, it is very varied. You can't really streamline, right? It is more in terms of what is it that you have to go couple by couple. You can't really generalize because what works for one couple, even in terms of the larger dynamic framework, will definitely not work for a very similar couple also. It is highly individualistic because again, we are slowly moving towards individualism more, right? That doesn't mean we are being selfish or self-centered. That is again one more doubt that many individuals ask. Does it mean that you have to become selfish. Not really, right? In fact, love means the priority is the welfare of the other person. That is love, right? But that doesn't mean that you are getting abused in the relationship and you are looking at the welfare of the other person. Then it becomes trauma bonding, which is toxic, right? Whenever there is toxicity in the relationship, then it is high time that you take a couple of steps backward, look at it from an objective point of view, and take a call for the welfare of the two individuals involved. I'm making it very clear, not when there are children involved, not when there are in-laws involved, not about the society, not about the community, but about the two individuals who are involved. Okay, so that is pretty much what I wanted to share with the group today. I am done with what I wanted to say. I think we are left with another 10 minutes. I would be glad to take on any questions. Was I clear about what I was expressing? Is there anything that you want me to go over again?
Ma'am, I have one.
1 minute, 1 minute. My computer is running out of charge. Let me just plug it. 1 minute. You can ask the question. You can ask the question.
Yes, ma'am. It was indeed a very wonderful presentation. The participants can ask the questions.
Ma'am, can I ask a question?
Yes, ma'am.
Ma'am, can I ask the question?
Okay.
Sorry.
Richard, sir?
Yes.
I've been dealing with couple counseling and I have clients coming in with mental disorder, like you mentioned, ma'am, that there are mental disorders. So how do you go about it? Especially when the partner is manipulative, the other partner feels very guilty and leaving a partner because they have a disorder. So how do you go about it?
See, first of all, you have to create the awareness for the other partner as to what the suffering partner is going through. As in, the person who is affected by the disorder, what he or she is going through, that needs to be clinically explained to the partner who is suffering because of the disorder. As a counselor, sorry?
The psychoeducation partner is suffering, like you mentioned, trauma bonding, it's a toxic relationship for the healthy partner, but the partner feels very guilty ki, okay, fine, right now my partner is not in the best of health and I am leaving the partner because it's getting very heavy for me. So how do you get them out of that?
Okay, see, number one, it is the person's choice, right? Now you cannot take responsibility for your client, right? You have explained the condition to the client, and all that you will tell the client is now it's a call that you need to take. Don't try to be in the relationship hoping things will change. Things will not change because it's a condition.
Right.
So you are giving a realistic perspective of what the disorder is all about, right? Now, supposing the person who's suffering, who's actually, which looks like trauma bonding to us, okay? Probably that person feels guilty that he or she cannot leave the other partner when there is a suffering from his or her side. Then you can tell this person about how to intervene. Right? What is it that you can do for treating the other person? See, in case of personality disorders, if you see, they will not accept that they have a problem because there's no insight, right? In personality disorders, according to them, they are right. Isn't it? So most of the times, you cannot treat them with their knowledge. So even if you are referring them to a psychiatrist, you will only tell the spouse, don't even tell this person that you are meeting a psychiatrist for this person. Okay? You contact the psychiatrist, and if you can take some medication which you can give this person without his knowledge in his minute dosage, so that his anger, violence, all that subsides, there will be a time after, say, 6 months or 1 year, he gets more rationality about his condition, and then you can take him to the psychiatrist, him or her.
Okay. Do about the children's involved in such a situation, because it becomes a very dysfunctional family and the children do suffer. So how do we go with the children?
We have to take the children also into the intervention mode. they also have to be explained that one of the parent is suffering from a problem. Just like how there is a physical condition, there is also a psychological condition. You have to go down to the level of the child, depending on however old the child is. That is one option. The other option is you can talk to the other, the normal partner of the two, and find out if there is any other alternative means that can come in terms of the support system. Is there a grandparents' home nearby where the children can stay most of the times, or get into the support modality of the parent who's suffering? Because most of the times what happens is there are circular reactions happening in these families. Probably the father is a borderline, so he is highly impulsive, highly irritable, extreme anger outbursts. So the moment the father shouts, the adolescent gets even more hyper and he shouts. So it's a circular thing. So once we take the children or the adolescents also into the intervention loop, then they know what to expect from the person and why is it a particular behavior is coming from that person. Right? See, all this will be handled in therapy. Does that answer your question, Disha?
Yes, thank you, Disha, for the question, and thank you for the wonderful answer, ma'am. Yes, Richard was there, willing to ask the question. Richard, kindly unmute yourself and ask the question.
Yes, ma'am. Am I audible?
Yes, Richard, please go on.
Okay, ma'am. That you said that love means the prayer.
Sorry? You're breaking, Richard. It's not clear.
Means the prayer is now clear, ma'am.
Voice is
Okay, you
breaking.
carry on, ma'am. I'll type it in the chat box. I'll type it in the chat box.
Sure. I'll see. Yeah.
Yeah, thank you, Richard. Any other questions?
Yeah, ma'am. Hello, ma'am. Can you hear me? Hello.
Yes.
Yeah, ma'am.
One at a time, please. Satya, kindly, you can go with your question. Vidya, you can be the next person. Yes, Satya.
Yeah, ma'am. Ma'am, is this marriage really necessary, ma'am? Is marital relationship? What do you think in your point of view, ma'am?
Generally, you're asking?
Yes, ma'am. Generally, I'm asking.
Okay. See, marriage in general, as a professional, if you ask me, personally, if you ask me, I would say, it's anybody's choice, right? Why do we even generalize it as a mandatory concept in the society?
Okay. If somebody is coming and telling us that marriage, we doesn't want to get married, okay. So we'll go personally, subjective. We'll just analyze and everything, okay.
Right.
And finally, we in what way we can conclude it? I'm just asking.
Even as a professional, you don't have to conclude, isn't it? Final choice, final decision is left to the client.
Okay.
You are only analyzing the pros and cons of getting married and not getting married.
Subjectively.
But on the other hand, in case if the person has a distressing reason as to not to getting married, or getting married for that matter, whatever. Like, for example, a client walks into your clinic and tells you, my father has been very abusive. My older sister got married and she also got married to an alcoholic. Okay. And therefore, I lost trust in the institution of marriage. This is a common thing that we see in practice.
Yes. Usually people will say yes.
Yes. So this is my personal experience, and therefore I don't think it is worth. Right? Now you have to tell the person, marital template, definitely there is no photocopy.
Okay.
Just father was abusive and your brother-in-law happens to be alcoholic. Now, where is the guarantee that you will end up with an alcoholic or an abusive husband? Then she will say, Appadidane.
Yes.
That's how it is, right? Then use your CBT.
Okay. Belief.
Right?
Okay. We have to go to the belief. Okay. Subjectively we can go. Okay.
Yes. Okay. Go to the irrational belief, challenge, dispute it.
Okay.
It's your choice whether you want to get married or not. Absolutely your choice. But you have to take the decision for the right reasons. That's about it.
Okay. That we have to make them aware.
Yes. See, sometimes what happens is, in the process of processing all this, early childhood trauma will come out. early childhood, some kind of an abuse will come out. So I mean, it gives you an opportunity as a therapist to process all that, isn't it?
Yes, yeah.
You're working on the individual.
Okay.
And
Okay.
he or she wants to go ahead with the decision, it's up to them. That's what I said. No, we are not matchmakers.
Okay.
Yeah.
Yeah. Thank you, ma'am. Thank you.
Yeah, sir.
Yes, thank you, Satya ma'am, for that question. And Sangeeta ma'am, you always make sure that it is the professional way of answering. We always, when we start giving counseling, what happens is we try to get connected with the people and try to solve the problem usually. So that part, I really admire you for giving such a wonderful answer. Thank you so much, ma'am.
Because once you start relating to the client, then you are not a professional there.
Yeah.
Then why are you there? The mother or the sister could have done it.
Truth, ma'am. Thank you so much.
But that's what relationships are very tricky, no? Because somewhere you also get connected. Because that is not something that, it's not that. All of us know what relationships are. Yes. So it's a very thin line that you're traveling. You have to be very careful.
Thank you so much. And Dr. Vidya ma'am, yeah, kindly go ahead with your question.
Hello, ma'am.
Yeah.
Ma'am, if in a relationship between a wife and a husband, if the wife is feeling to take her counselor's help for a counseling.
Sorry, come again. The wife?
No, ma'am. The wife wanted to mend the relationship. She wanted to mend the relationship.
End.
Yeah. No, mend. M-E-N-D.
Mend.
Want to work out.
Mend. Okay.
So, if the husband is not cooperating to attend a counseling session, is there a possibility the wife alone can go attend it and she can come out of it? Because the problem is with the husband, right? Like the husband also should come, but he denies to come. So how to go about it?
Okay. So you're saying that both of them are not willing to come. In fact, I would say about 40% of the wife are like that, no?
No, ma'am. Both are not willing, right? No, the wife is willing.
Wife is willing.
To
Husband
meet
is not
a
willing.
psychologist. Husband is not, wanted to come to meet a psychologist.
Correct.
But they have to work out the relationship.
Okay.
Yeah.
Basically, what happens is, I'll tell you how it works in reality. So it will be the wife who gets connected with you. Okay. Now, when the wife connects with you, you get pretty much an idea of what is going wrong in their relationship dynamics.
Yeah.
Right? So you will deal with your client. There you are not dealing with the relationship. You treat that person as an individual client.
Okay.
Right?
Will that work? Will that work? Like
Definitely. Because just because this one person is reaching out to you doesn't mean the changes are warranted only in the other person. You get what I'm saying?
So,
there will be some changes which this person also requires in him or her. And once those changes are implemented in the relationship, there will be minute corresponding changes from the other person as well. See, most of the people refuse to come to see a professional because they think they will be advised. They think the professional is going to tell them, you are wrong. Don't do it. It's a threat for them. That's why they don't come.
Okay.
Right? But with this individual client who comes to you, you can bring small changes in the individual client who will in turn reflect that in the relationship, which will in turn bring about small changes in the other person.
Okay. But the husband character is not going to change,
Okay.
Because he's not attended.
That's his personality. Right?
Yeah.
If the husband is not going to change, now no matter whether he comes to you or not comes to you, he's not going to change. That's him. Correct?
Okay.
Isn't it? So it is a call that the wife needs to take as to what is it that she wants to do with her life.
Okay.
Probably she has to change the boundaries that are already existing in the relationship.
Okay.
Right?
But that will work, right, ma'am?
This is more the dichotomy of control. No, you first have to be clear about what is within your control and what is not within your control. We are not magicians to bring about. It's not the professional nor the wife. We are normal human beings, isn't it? So we cannot bring changes in another person when he is so clear and rigid that this is me. What do you think?
Yes, that is what my question is.
That's what.
Ma'am, in this case,
Sorry?
if wife behaves, in this case, if wife behaves assertively to mend or help her husband to change, and the problem could be solved little bit.
See, you're partly right, Amrut. If the wife behaves assertively, probably the problem is solved, but definitely she will protect her emotions because that is within her control.
Training in CBT to that woman, you can solve the problem where the husband is very rigid.
I didn't get you, Amrut. With CBT, you're asking whether the problem can be solved.
If CBT, the wife can be taught to become a little assertive, she can solve her problem and change her husband or bring him to the cooperation.
You're asking whether it can be done?
Yeah.
Not really. Can't say. So we are trying to predict what the husband will do or will not do. Isn't it? See, I am employing CBT for the wife, okay, to make sure that she is not getting distressed in the relationship, not with the intention of changing her husband.
Okay.
That is the goal of therapy.
Okay.
Thank you so much for that wonderful answer.
Yes,
Thank you.
Thank
And
you.
ma'am,
Thank you so much.
yes, thank you. There is a question in the chat box. Kindly.
I know it's increasing. I'm just trying to figure out what I need to answer.
Yes, ma'am. This person, yes, ma'am. This person has texted you like long back, so I want to read out the question for you. Is it okay, ma'am?
Yeah, please read out.
The person's name, it is said as LO. Okay. It is necessary for both husband and wife to make an effort in their marriage.
Definitely, yes.
May it be sharing financial responsibilities or keeping the romance alive. Do you think this is only the I don't know what prerogative, I'm not sure what was the word, ma'am, of any one spouse? Can that person unmute yourself and ask the question, please?
Yeah.
Yellow. Who is it? Prerogative was the word, ma'am.
I think someone is trying to ask.
Yeah, ma'am. Kindly, elbow whoever it may be, you can unmute yourself and ask the question. And yes, the next person, you can ask the question.
Can I just, before that, look into the chat box and answer a couple of questions that are there?
Yes, sure, ma'am.
I think there's a question from Richard. Love means priority of the welfare of the other person. That is love. If we are being abused in the name of love, that is a toxic relationship. Now, if I'm in a toxic relationship, what should I do to make it into a non-toxic relationship? Kindly give me a proper solution, ma'am. Okay. Richard, if you have identified that you are in a toxic relationship, what is it that you want to do about it? Richard? Richard, are you here?
I guess we lost him.
I think there were some connectivity issues for him.
Yes,
Okay.
yes.
Okay. The general answer for that would be that if you have identified that you are in a toxic relationship and you still continue to want to be in a toxic relationship, then you are showing trauma bonding. Right? Now here, the idea is to not to change the toxicity of the relationship into non-toxic, but for you to take a call whether you want to continue to be in the toxic relationship or not. Because you have identified that it's toxic. Even after identifying, what is it that makes you stay in that relationship? Why is it that you want to endure toxicity for yourself in the relationship? right? Now you need to introspect and ask yourself, in spite of experiencing toxicity, what still holds me on to this relationship? Okay. Next
ma'am.
question.
There's a question from Sivagami ma'am.
One more.
Yeah.
And I know even I have flaws in me. Sometimes I'm being nice to my girlfriend, and sometimes, oh, that's also from Richard.
Yeah, it's Richard. He has explained the thing. Probably if he gets the recording, I guess, or we can share if he can get
Okay, then
connected
I'll
to any of us, we will give your number to
Yes,
him.
and I know even I have flaws in me. Sometimes in being nice to my girlfriend, and sometimes I'm being so harsh. I'm really emotionally abusing her a lot. It's my insecurity. What should I do not to have this insecurity feeling? So you have identified that it is your insecurity which is causing this. So all you have to do is go to a therapist and get CBT done on you. Right?
Yes, ma'am.
That should solve the problem. Yes.
There's a question from Sivagami ma'am. Madam, how can common people identify the cluster B personalities in our day-to-day life?
Difficult. Because, like I told you, personality disorders themselves are hidden under the carpet. They are disorders in disguise. And cluster B are the most disguised. Because, like I told you, these are people who can be really sugar-coated, extremely manipulative, right? Who can slap you hard and fall at your feet. Okay, and when you are in love, what stands out is not the slap but falling at your feet. Right? So it is extremely difficult for normal people to identify personality disorders, not cluster B in particular, everything, more so cluster B. So that is why professional help is needed, because you get an objective view of what it is. See, just because a person gets angry, you can't generally say he's borderline. Right? This is like how we use the term depressed, no? I was so depressed, I'm always depressed. No, if you're really depressed, you wouldn't be doing what you are doing. Now, this is like saying my child is hyperactive. How old is your child? 2 years. Why do you say he's hyperactive? Because he's running around. Array, a 2-year-old will run around. That doesn't mean he's hyperactive. Now, these are terms which we generally use left, right, and center today without even understanding that it is a label we are attaching to an individual. We have to be accountable for it, don't we? Right? So it is better that we don't get into that thing of identifying ourselves. Let's seek proper professional help to be clear. Does that answer your question, Sivagami?
Yes, beautiful answer, ma'am. Questions are piling up again.
Oh, you.
Yes, ma'am. We can have 2 more questions and wind up. Is it okay, ma'am?
Sure.
Thank you, ma'am. Okay, the question is from Suganti. How can one deal with a physically abusive partner?
Abuse. I'm not saying it's physical, verbal, emotional, sexual abuse. Any abuse has a zero tolerance policy. Right? Now, let's not look at it in terms of how to stop the partner from physically abusing. Now, the reason why the partner is physically abusive, see, physically hitting sometime, probably in 20 years of marriage once, probably could have been an impulsive behavior, followed by apology, okay. But when it is abuse physical abuse, okay, then it means there is a problem. Possibly he's a cluster B personality, very narcissistic, because narcissistic abusers are like that. They're pit bull abusers. They're called as pit bull abusers. They are as ferocious as a pit bull, and the next minute they come and fall at your feet saying, Teriyama panita. Teriyama 500 தடவை பண்ணுவாங்க. Okay? So what I'm trying to say is, any kind of abuse holds a zero tolerance policy. That's it. Now, in spite of that, you decide to hold on to the relationship. It is your choice because it is your relationship. The counselor will not tell you quit because it is not her relationship. You have to own responsibility for your decision because it is your relationship and you are being abused. Am I clear?
Excellent explanation, ma'am.
Yeah.
Is it okay if I ask a question, ma'am?
Sure, sure.
Okay, I'm a big fan of you, ma'am. Before I could say anything, I have attended your workshop. I have attended your workshop of yours in RJNID when I was a student. Only one workshop, but then even now our batch students make sure that we speak about you when if anything, if it is the relationship issues or something, we go to relationship enrichment workshop by Sangeeta Maheshwari. It's always that even now till date.
So happy. I'm so glad. Thank you for that.
Thank you so much, ma'am. So my first question is, since I'm in the age of like marrying and all those things, I have seen few of my like sisters, cousins, and everyone. They are brought up in a way that they are independent. Like they can drive their own vehicles. They can go out on their own to different states, to different countries if want. Drive a car and everything. But then when they get married to a particular family, arranged marriage. So that family is so protective of the girl child, where they don't allow you even to take the bike and go out. Or even if you're going to work, it's like already spoken and you are okay with going to work, but I will go and leave you to work and I will take you and come. So, and a lot of people who are actually very talented, but after the marriage, whatever it's not because they love, and get committed with the relationship, they stop, or it's more of suppressing their own talent and their achievement is stopped and all those things. So how it's a curiosity, ma'am, actually. How do people actually deal with it? Is it, I don't know, for me, I don't know, but is it possible to actually accept it truly? No reason.
Okay. So if you tell me that these, probably one individual you're talking about, let's say, now if this individual has been so independent, right? But now after marriage, she's so dependent, right? Isn't it? Because husband has to drop her.
Dependent kind of, no, ma'am. She's supposed to be an dependent person.
So there is a shift from independence to dependence, not consciously, not willingly, but it's forced, let's say. Okay. But when it is forced on her, why is it that she's accepting it? I'm not asking, why is she accepting it? I'm asking, why is she accepting it?
Again, the reasons that you had already said, probably due to the family situations that she has some things on. But these are the reasons, no, ma'am. It's not that.
No, my question is it an assumption for us to think that because of the family, otherwise there'll be a conflict? Is it an assumption? Why could not it be? I'm not saying it is. Why could not it be somewhere the husband is compensating complementary in this relationship?
Could be, ma'am. Yeah.
She's happy finally because it's a complementary arrangement, complementary dynamic.
Yeah. So there is even if we miss something in life, there is something else that is compensating, so it is not being valid.
I'm not saying that. I'm not saying. But for the individual, probably that is what it is. It is her marital template, isn't it?
Yeah.
I cannot draw a template for her.
Yeah, true.
No?
It's the individual. Yes, true, ma'am.
Yes.
Yes, ma'am. It did answer the question as usual. Yes. A wonderful answer. Thank you so much, ma'am. Subha, ma'am?
Yes, ma'am. If I'm permitted to ask, this is Disha again.
It's Sangeeta. Okay.
Can we have this as the last question?
Yeah, because it is actually time. She has other commitments too. Kindly wind up with this is the last question, please.
Okay. Yes, Disha.
In current time, I'm getting couples who come to me that their sexual,
intimacy has reduced a lot because of work from home, and they're not engaging. They don't have an issue with it, but they are asking, will it be a problem later in life because they're engaging into sex once or even less than that. So what do I tell them? That it is not a problem currently, but they're asking, will it be an issue later on?
Right. See, sexual frequency, there is no yardstick to it, right? I mean, X can engage in sexual intimacy once a month and be highly satisfied with that, but Y can have sex every day and completely be dissatisfied with that. So there is no yardstick for us to measure sexual frequency to say which is good and which is not good, right? So it is not all about the frequency of sexual act, but more about the sexual intimacy in the relationship, which also involves non-sexual physical touch.
Platonic physical touch, cuddling and,
Yes. So that talks about the sexual intimacy. So when that is in place, now it is only a situational thing that sexual frequency is reduced. But when that sexual intimacy is not there, definitely sexual frequency will take a big hit. See, that is our point to understand what is the trend it will follow.
So could it be a difficulty? Because everybody is working from home and there is no boundary of work-life balance. So could it be a problem that they are not able to give presence? Like people are working from home and
Disha ma'am, your voice is breaking. You can
kindly write down your question and send it to us. We will definitely contact the resource person and we will answer your questions through her mail. Kindly write down the questions.
Yes, ma'am. And there are few participants who are asking how to reach you, if any email ID or phone numbers they are asking, ma'am.
You can reach me through mail. You can reach me through phone also, but kindly WhatsApp me. I may not attend calls half the time. Okay, because when I'm in my consultations or such sessions, I don't even see the phone. But I will definitely respond to you through WhatsApp.
Yes, ma'am. Your website, if you wish to say, they can.
I don't go to my website. So you can visit my website to see what I'm doing. But if you have to reach out to me, I prefer WhatsApp.
Okay, participants, if you really want to contact ma'am for any help, kindly get to us, any of the team, core team members. Probably we will get you in contact with her. Or you can send your queries and feedback to mywebinarfeedback@gmail.com. Now I request Subha ma'am to give the vote of thanks. Sorry.
Actually, I was overwhelmed by seeing Dr. Sangeeta actually.
After years, I think we are seeing each other.
A lot of love. I'm so excited. I just sat and listened to her after a long time.
That's nice. So glad.
Thank you so much, Dr. Sangeeta. It was an excellent presentation. It is an, I know that you will rock. Actually, this is a core subject of yours. And I know the importance of this subject also. Our entire participants were actively participating. And I could see a lot of them have been questioning a lot and they have so much questions to ask also. So I think it is a right time to hold such a importance for relationship counseling, I think. So I thank you so much from the core team and Department of Psychology, American College, as well as Madras School of Social Work and other associates like Red Pond Academy and MS Challamuthu Trust from Madurai and other co-collaborators. And thank you so much for your wonderful presentation, as well as the free-flowing thoughts, process, and as well as your counseling expertise. We could see from your presentation, you were just flowing like an air. Thank you so much. It was a wonderful interaction we all had with you, and it is very important topic at this present moment. And thank you so much for your valuable time and expertise shared here. Thank you.
Thank you, core team. Thank you for the opportunity. We will meet up sometime informally.
Sure.
Thank you all. Thank you, participants. Bye.
Thank you.
Ma'am, have a good